This is a procedure for replacement of the base of the proximal phalanx and a lesser MPJ using the Phalanx Mini Hemi titanium implant. The implants come in 5 circular sizes: 9, 10, 11, 12, and 13 millimeters. The implants are anodized and the sizes are color coordinated to match the footprint of the implants. The stem of the Mini Hemi is essentially a cannulated screw with the tip hand sharpened. It requires no drilling, tapping, or broaching. We are going to replace the base of the phalanx in the 4th MPJ. We will first locate and mark the 4th MPJ.
And I am going to be your assistant.
We make a dorsal cut about 6 centimeters long. Expose the joint and dissect the soft tissue to free the joint completely.
New 15 anyway.
It's not. Okay. Well, there's a brand new blade over there.
Hey, get closer to him and drop your arms down.
Yeah, just a second. Right? Yeah. Drop it. Yeah.
You're out of the camera, so you can get close to him.
Okay.
Thank you.
Where's the other retractor? No, not this one. I'll use it too. I'll use this.
Once the phalanx is freed from the attached tissue, the surgeon makes a cut, no more than 2 millimeters thick. The Mini Hemis are relatively delicate implants. They are about 1 to 1.25 millimeters thick. The blade used should be about 4 to 5 millimeters wide, not wider. A narrower blade will not produce a straight cut. The surgeon continues dissection until the base is completely free before cutting. The cut should be neutral, perpendicular to the shaft of the phalanx. Any angle in the cut will translate into change in the orientation of the phalanx with respect to the metatarsal head. Once the cut is completed and base removed, the next step is to determine the implant size. Starting with the middle size, 11 millimeters, the sizer does cover the bone surface completely. The surgeon opts for the 11 millimeter size. With the sizer in place, a 1.1 millimeter K-wire is inserted into the sizer cannulation, perpendicular to the cut surface and collinear with the phalanx shaft. The sizer is then removed, and if the wire appears loose, advance it further.
Just a little bit more. Perfect. Okay. Let's go ahead and get our implant. Right there.
Slide the implant over the wire.
And with this here, okay, I'm going to tell you some of the problems we ran into with the first.
Engage the driver and proceed to screw it in place until it is seated nicely, without any gap between the back of the implant and the phalanx.
Can you see? Can anyone see?
I can see it if
It's
you keep your arm
beautiful.
in that position.
As I joke with everybody, we make good screws. Once it is seated, don't fight it.
No. She is not fighting yet.
And this is circular, so there is no problem. Do you understand? And
It's
don't
not
go.
it's not the oval one.
Yeah, and that is fine here. We're slightly off, but
That's okay because of
After implanting is done, remove the wire, irrigate, check range of motion, and close.
okay, you want
yeah,
to take the
take
wire
the wire
out?
out.
I told you, once Basile left, everything is working.